So, good afternoon. So, today we will learn about clinic management software and pharmacy software integrated software. So, here uh, I am opening Google Chrome browser or any web browser we can open, and I am entering the username and password of the user and clicking on login. Once I click on login, I will be you will be able to see the patient's clinic registration. So in clinic registration, this is used for clinics. So the very first step in clinic registration is it is very easy step. Once the patient comes to us, we will type the name, age, mobile number. This is called the patient registration of the clinic. For example, name of the patient is Mrs. Sana. Age is 25 years. Mobile number is 9700 730044, and we can save. So this is patient registration. The next step is, for example, we are doing some billing. So here we can enter the doctor name, take 300 rupees from the patient and save. So now we will get the bill of the payment. So this is the patient registration. This is billing. The next process here is the prescription for the patient. The prescription which will be given to the patient where the doctor will write it. So here we are going to select, and here we'll get the prescription. This prescription you can take the printout on the letterhead, and the doctor can give the prescription. So this is the clinic registration. So now we are also having one more thing, that is shift. For example, I am a receptionist, I am doing the billing. So how many total collections I did, I will get all the details in the shift collection report. Here we are having this doctors module. Here we can add all the doctors who are working with us as consultants, and we can also write their, we can also save their consultation charges depending upon their requirements. Okay, so the very next process is the inventory module. In inventory module we will learn about the pharmacy sales. For example, a patient comes to us. So here we can enter the mobile number, and we can give the medicines to the patients. For example, it is Dolo 650 mg. Quantity is 10. Total amount is 60 rupees. So we'll be taking 60 rupees from the patient, and we'll be saving. Whether the payment mode is cash, online, we can save it and save. So here we will get the pharmacy receipt or the bill. So here we can also get to know the, we can also add the different type of vendors. This is the purchase entry where we can add the invoices, and in the invoice what different items we are bringing from the patient, purchasing from, sorry, bring purchasing the items from the vendor, we can add here. Because once we do purchase, only then we can do sales. So next process here is the inventory reports. We can get different types of inventory reports. How much is the item wise stock? How much is the invoice wise item stock? How much is the purchase? How much is the purchase item wise? How much is the bill wise sale? How much is the item wise sales? And sales day wise. Vendor purchase report also we can get, we can use it. So here it is a very easy software. Easily you can do the patient registration in the clinic, the billing, and the prescription generation. And the next in the inventory is the pharmacy, where you can do the purchase entry, and also you can do the sales entry. The next here is the expense entry, where you can add any user who is doing any expense. Here you can add any expenses which is done by the user. In the same way, we are having some analytic reports where we will get the different patients visit in our hospital, total patients today, how many the patients, how much total patients came today. Okay, how much consultant doctor billing we did today, how much is the total collection. We can also get the reports on a weekly, daily, on a monthly basis. So it is a very easy software, easy to use. It will help you reduce the leakages, the bill freight, and easily you can manage the complete application. Thank you so much.